Femoral acetabular impingement is one of the most common sports problems seen in young, active, athletic people. It causes hip pain and then some kind of a catching sensation in the hip and also limitations in the motion. Usually there's an underlying cause when you have a labral tear. It could be due to femoral acetabular impingement, which is characterized with a bony bump in the femoral side. On the junctional area of the femoral head and neck, there usually be seen a bony bump which causes this impingement. In this impingement, what happens is the labral tissue gets squeezed between acetabular rim and also that bony bump area. This causes the labrum degeneration in time, and then eventually degenerated labrum can easily be torn apart and symptoms get more serious. The treatment of the acetabular labral tears with the impingement syndrome depends on the patient's activity expectations. In young active patients, usually surgical treatment should be considered. In this group patients, it's not just treating the labral tear, but also addressing the femoral acetabular impingement is crucial. These surgeries or these treatments can be done easily with arthroscopic surgery. And with arthroscopic surgery, what surgeon does is he or she removes the bony bump on the junctional area of the femoral head and neck, and then provides a good smooth contour to have a better relation without impingement and have a good motion without any impingement of the area. And after then, the surgeon turns his or her attention to the labral tissue and then checks the labrum. If it is degenerated but not torn apart, it could be useful just to do a kind of debridement by shavers or by using arthrocare. But if there is a kind of tears, sometimes we need to repair that tears. And in today's technology, we do have very good anchors to put the labral tissue back into the acetabular rim where it normally belongs to. In some cases, if we are late on treatment, we may have some acetabular osteophytes on the rim of acetabular tissue, which may cause further impingement. In that case, the rims, also these osteophytic rims, should be removed by arthroscopy. And then the important thing about this treatment option, it's maybe a day surgery, but after the surgery, it's important to have a good rehabilitation period. Most of the patients return their normal life within 6 weeks, and then after 8 to 12 weeks, they can return their sportive activity gradually, and finally they can fully recover and then turn their activity levels before they have symptoms of the hip. This arthroscopic treatment has very advantages. One of the advantages is it's a mini-invasive surgery. It doesn't cause any harms, and then also it is done usually with 3 holes, and within 3 holes that we call them portals, you get into the joint, and one of the portals is used as a video camera portal that we can see inside the joint, and then the other part